Yeah, well, fecal incontinence we consider it as either having a bowel movement or leakage from the anus when the patient doesn't want it or doesn't realize it. So like staining of the underwear or feeling or not be able to hold the bowel movement. That's what we call it. There's an active and passive. Active is when actually patient feels the bowel movement coming out without being able to hold it, and passive is when just doesn't feel it, and when he goes to the bathroom finds some staining of stool in the underwear. Usually what we do is go over the history of the patient. Sometimes it's just effect of diet, having like loose bowel movement is obviously more difficult to hold. There can be medication that can affect that. Patient can have, for example, history of operation to the anorectal area. They can have history, for example, for female is more frequent because those muscles of the pelvis are thinner, less strong, especially going, getting older can be a problem, and female during pregnancy can have damage to that muscle. Sometimes they, during the delivery, they have to make a little cut on the posterior area of the vagina. They can affect the muscles of the sphincter as well. So they are sort of like predisposed to that. Female are more predisposed to like weakness of the pelvis, in general as well, and that can manifest as fecal incontinence, different degrees, different levels, but still fecal incontinence. Female are usually the one that have more commonly this problem. Usually is caused by the fact that the pelvic floor of a female is broader because the pelvis is broader for childbearing, and muscle is thinner and is less strong, especially on the anterior part of the sphincter, but in general. And then having the fact of becoming pregnant and have a big uterus that tend to stretch the pelvic floor, tend to stretch the muscles, and that with time it makes the muscle weak. As I said, the nerve is is kind of damaged because of the stretching and the delivery. You can have the little cut on the posterior side of the vagina, the epiphysiotomy, which is very common during vaginal delivery, and that can provide some additional damage to to the muscle. But usually it's not very common to have acute incontinence after the delivery. Usually it's like a small damage at that time, and then with with aging, the general like decreased strength, and then develop later on. Well, psychological issues are very big. Obviously, it's self-esteem, self-confidence, being very uncomfortable being outside. I met patients that were almost like bound to their home because they were, concerned, afraid to go out. Obviously, you have leakage, you have bad odor, you feel, dirty, uncomfortable. So there's people that it really like bound to their home, and they're very afraid to go out. And the patient that we were able to help, that is definitely a life-changing situation. Patient that we did that procedure that I was mentioning before, the cervical nerve stimulation, they went from like never go out to being able to take longer trips again and not be worried about it. And they were young patients. I mean, I had a patient of about 50-year-old that really wasn't able to go out anymore. Very nice lady, and young, and she couldn't do that. And after this procedure, now she is.